Hi, this is Jacqueline. I'm back with my next video. So today I do want to talk about something called EBOO filtration. So if you haven't seen my last few videos on monoclonal antibody infusions, please check them out, as I do believe that MABS has been the most beneficial thing I've done up to this point. But because as a long hauler, our blood can be thick or susceptible to microclotting, I did want to try something called EBOO filtration. EBOO filtration is similar to dialysis, in which it goes ahead and cleans out and cleanses out the blood. I went to an amazing facility down in Santa Ana, California called AMA, and according to their website, this EBOO filtration cleans out our blood. It cleans out the endotoxins, which are fragments of pathogenic bacteria, molds, and infections that have been killed. Biofilm, a kind of sludge that many pathogenic microbes create to hide in and where our immune cells cannot permeate. And lastly, debris from our own tissue that has been damaged from the infecting microbes. I went down there and I did a video of the whole experience, so you can go ahead and actually see the video. You can see the film and the debris coming out and how the machine actually oxygenates and filters out the blood. So I'm gonna go ahead and run this video, and then on the other side, I will let you know how I'm feeling and my basically review of EBOO filtration.
Okay, so we're here, all hooked up. This is the machine here, our EBOO machine. So what's happening is, this is our pulling site. So this is where the blood's being pulled out, and you can see already that there's a bunch of stuff coming out in the tubing that does not want to be inside. See all that. So it's pulling the blood out, and it's going into this, this red tubing here, and going through. This is like a little turning mechanism that helps the blood flow through the tubing properly. So it's coming in here. This is the filter, this long thing here. So it's going into the filter, and there's fibers inside the filter. Kind of hard to see now, but all that gunk that's coming out there will be stuck in these filters. So it's up, going up, 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 filtering, hits the top part here. And here's where it's cleaned. And this little guy up here is where the ozone comes into place. And that's what the machine does, is it creates that third oxygen molecule that's creating ozone. And it's ozonating that clean blood. And you can kind of see how the difference in colors are. That's the blood coming out. This is clean, oxygenated, ozonated blood. So it goes through this little chamber, and that clean, nice, ozonated blood is going back into the other side. So how are you feeling?
I'm good. I'm not passing out.
She's still going. She's doing good. Okay.
Yeah, so as you could see from the video, the blood was really thick, and you could see a lot of debris coming out of the tube. The nurse actually had to sit there and flick at the tube to get the blood to start flowing, and she had to do that multiple times. So that was my first session. I did go back and have another session a week apart, and you could definitely tell just within the 2 sessions that the blood was flowing much smoother and easier out of the tubing the second time, and that there was way less debris in the filter. So it's definitely a testament that the filtration system is working. They do recommend about 4 to 6 treatments for these types of chronic viruses and infections. However, I'm going to do 3 sessions. I am signed up to do 1 more session a week from today, so I will definitely let you guys know how that goes. But it was cool to see the difference between the first session and the second session, and to see how the blood just wasn't nearly as thick and there wasn't much as nearly as debris. So after the first one, I had a slight herx, meaning that, you know, I think our body's just ridding itself of all the toxins. The only thing I really felt after the first session was I felt a little bit tired. I drained, I had to take a nap, nothing super major. Actually, the second session, I had a little bit more of a herx reaction. I felt a little more lightheaded, a little bit dizzy, slight headache, and I just felt a little bit overall more tired and drained from the second time. I'm not sure why that is. Some theories are that it just kind of catches up with you as your body is just detoxing all of this stuff from your system. So yeah, you have a few days where you do have a little bit of that herx reaction and you don't really feel that great, but it's really overall mild, and I'm feeling feeling a lot better today. After the first treatment, I just had the Herx for like 2 days, and I had a really pretty decent week last week. And today, I'm feeling pretty good too. I had the Eboo on Friday. Today is Sunday. I definitely feel like it's helping. I think collectively, all these things help together. You know, unfortunately, there isn't just one cure-all that you just do this and, you know, all of this goes away. It's definitely a combination of things, whether it's the viral persistence, getting rid of the spike proteins, which is what the MABs are gonna do, and then stuff like filtration, Eboo filtration, which is gonna help filter out the blood and help with thickening, microclotting. I mean, it's definitely not at the same level as HELP apheresis, as that is really getting in there. I don't understand exactly how they're different, but I know that that's much more extensive and really is looking at getting rid of the microclots. But because right now that's in Germany, I decided to do the Eboo filtration here and just to try to get the benefits of doing that procedure. I am looking to do another set of monoclonals. I do believe out of everything I've done that has been the most beneficial. I'm probably going to wait a few weeks because I'm going to do one more Eboo again next week, and then I'm going to wait a few weeks, see how things go, and then possibly do another infusion. So please check in with that and I will let you know how that goes. Right now, of course, please be safe. We now have this new Omicron variant out there, which is making things much more complicated. As we know now, it's more highly transmissible. We're not really sure how well the vaccines are holding up against Omicron. And there have been some studies that have showed, which I will put the link in the description below. I will also put the link in the description below of the facility in which I got Eboo filtration, because it is an absolute beautiful facility. And I will put a link in the description below about some studies I have read that some of the current monoclonals aren't really holding up against Omicron. So that's definitely not great news. The Regeneron and the BAM are just not giving the same results. And there's actually another monoclonal, which I'm not super familiar with, but it's from GlaxoSmithKline, and it's called Sotrovimab. I don't know, that's my best, I'll put it up here. That's my best guess with pronunciation. That monoclonal is looking to be the most effective against Omicron. The issue is just gonna be what the supply is right now. And then obviously for people who have not been infected with Delta or have never been infected, right now we're just really not sure. I mean, if you go in for an infusion, you're just not really sure what strain of the virus that you're getting. And from my personal experience, I feel that Regeneron worked very well against Delta. Again, I'm not sure. This is just all new information that's coming out that this new monoclonal antibody is going to work better with Omicron. Hopefully that'll be widely available and people will be able to get it. And I'm sure it would be helpful if we know if people, you know, are going and getting testing positive right now, what strain that they're getting. So of course, just more complications right now and more confusion. So please just be safe, be well. The long haul community, we've all been through a lot. And of course, no one wants to get another infection again at this point. So mask up, keep your distance, and be well.
Merry Christmas! Don't forget to like and subscribe.